Hi, I'm Dr. Kyle Schweser. I'm an orthopedic surgeon with the Missouri Orthopaedic Institute at MU Healthcare. So that means that I basically deal with bones, muscles, joints. For my two specialties, I'm a trauma surgeon, so I fix fractures. So people that break their bones, I fix them. And then from a foot and ankle standpoint, anybody that has foot and ankle pain or arthritis, I will tend to see them in my clinic as well. As an orthopedic surgeon, it's easy to get really focused on what I've fixed. So, does the hardware look good? Is the bone healed? Can they walk on this yet? What can they do physically? But mentally is also a big driver of how people respond to a trauma. And it's something that I try and sit down and really talk to my patients about to try and figure out exactly what I can do to maximize their recovery from this injury. Really, I just kind of like to hang out with my kids. I spend a lot of time at work, so I really try and devote a lot of my free time when I'm home to them and to my wife. But if I have a vice that's outside of the normal, I like sports and I like my family, I actually like video games, so I'll play video games occasionally. One of the best parts of my job, one of the things that I find the most satisfying is helping guide people through this traumatic time. On the foot and ankle side, it's mostly they're coming to me with pain, so they've had this pain forever. So to have them come back to clinic and say, my pain is gone, is very rewarding because they're just excited to get back to the life that they've lost because of the injury or the pain. And so I think it's very rewarding to help them get back to that.